Hello, my name is Savannah Romero, and today I'm going to be presenting an infomercial on tobacco. So what is tobacco? Tobacco is a plant that is grown for its leaves. Its leaves are dried and fermented before being turned into tobacco products. Tobacco contains nicotine, which is a highly addictive substance. Many other chemicals are either created when tobacco is burned or found directly in tobacco. So the history of tobacco. The plant was originally discovered by native people in Mesoamerica and South America. Natives of South America would often use tobacco for medicinal purposes and religious ceremonies. It was then introduced to the Old World with the arrival of Columbus in the Americas. Throughout most of the time, tobacco has been used recreationally since it has many ways of consumption. By the 17th century, scientists figured out smoking tobacco has negative effects. From 1800s to the 1960s, tobacco use was growing exponentially. Tobacco industry is always changing, making new customers by marketing new strategies, targeting new populations, and finding new ways for consumption. The different forms of tobacco include, but are not limited to, cigarettes, cigars, chewing tobacco, and e-cigarettes. Typically, tobacco is either smoked or chewed. If it is smoked, it is typically used through a pipe or hookah, beedies, kratak, cigars, and or cigarettes, and the nicotine is inhaled through the lungs and enters the bloodstream then. With chewed tobacco, different forms include chewing tobacco, snuff, which can also be sniffed too, dip, and or snooze, and typically it is placed in the cheek or between the front lip and gum. So the risks and consequences. Pregnant women risk having a stillborn baby, miscarriage, having an infant with a low birth weight, or their child may have learning or disability problems growing up. Additional risks and consequences include addiction that may occur due to the presence of nicotine. Smoking may lead to lung cancer, emphysema, or chronic bronchitis. It is estimated that 90% of all lung cancer deaths are caused by smoking. Men who smoke are 25 times greater to develop lung cancer than non-smokers. As for women, smokers are 25.7 times greater to develop lung cancer than non-smokers. And there is also an increased risk of heart disease, which can then lead to a heart attack or stroke. Continuing with risk and consequences, people who do not smoke may be exposed to secondhand smoke, which still has consequences for the people who do not smoke. Secondhand smoke can lead to lung cancer and or heart disease, as well as causing a stroke and or coronary heart disease. Children may be exposed to secondhand smoke, which will then increase their risk of either asthma, sudden infant death syndrome, also known as SIDS, acute respiratory infections, and respiratory symptoms. Effects on the body. For short-term effects, there are coughing, bad breath, and fatigue. Long-term effects include cancers, pneumonia, and an increased risk of heart disease. Other effects on the body overall include blood clotting, premature aging of the skin. An example of that would be wrinkles, diabetes, chronic bronchitis, chronic obstructive pulmonary disease, also known as COPD, eye diseases, and immune system problems such as rheumatoid arthritis. Some statistics. It is estimated that $170 billion is spent annually on medical care to treat smoking-related consequences. 1 in 5 deaths are tobacco-related in the United States. 50% of Americans die prematurely due to secondhand smoke exposure or smoking. There are about 3,800 young people who will start smoking in the United States today. In the United States, tobacco usage is the leading preventable cause of death. So the benefits of quitting smoking include a decreased amount of carbon monoxide in the bloodstream, improved body circulation, and within months there will be minor improvements with lung functioning, and both the heart rate and blood pressure will return to normal levels as they are typically high while smoking. And these are my references. Thank you.